But the literature shows that leftover opioids are a big risk to our families and our communities. There's plenty of anecdotes about teenagers using opioids recreationally, and the literature shows that over 75% of heroin users actually started with prescription opioids, either their own or those from a friend or family member. And we found that over a third of patients took 0 opioids after surgery. And furthermore, of all the opioids prescribed, over 60% went unused. And of those that were unused, fewer than 10% were disposed of appropriately. So that all concludes that many of our surgical prescriptions to our patients result in leftover opioids remaining in their homes. So we worked with orthopedics to look at a set of procedures and look at historical prescribing and now patient consumption data to develop procedure-specific prescribing guidelines. And they went live in late summer of 2017. And our initial data showed that the opioid prescribing dropped by half. So patients were taking home half as much opioids as before, but the refill rate didn't increase. And that shows us that patients were just fine with the amount that we were sending home at half the level. So the biggest surprise from our survey data is that a third of our surgical patients took no opioids. And when we had been aiming to develop guidelines, we had been aiming to develop a certain number of pills for certain patients and procedures, maybe 5, 20, 40 pills. But what we found from the survey is that there's a real opportunity to prescribe 0 opioids and encourage other methods of pain management for many surgical patients undergoing procedures here at Mayo Clinic. So in the future, surgeons are going to attempt to better tailor their prescriptions to the amount of opioids patients need so we can minimize how many opioids are left over.